welcome. You are listening live to Heart-2-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian, a licensed marriage and family therapist and a certified sexologist here at KMET 1490 AM ABC News Radio Live. And we just had a little bit of a technical issue, which I hope it's resolved. Here I am with Dr. Robert Jaffe.
Here we are. I am Dr. Robert Jaffe. I'm a licensed marriage and family therapist, along with my beautiful best friend and business partner, Dr. Mitra Rashidian. Today we're going to be talking about addiction, the biggest one of which that is unnamed usually is what we call codependency. We've talked a lot about that. We're here to let you know that actually you do contain everything you need inside of you to feel happy, joyous, and free. We believe that you are born into this world as your loving, authentic, true selves, and you come in with many beautiful qualities, a couple of which are we come in open, or we all come in curious. We come in honest. Yes, we do. We're honest when we come in. We have to learn how to lie. We all come in as sexual beings, and we all come in trusting. We trust automatically. We have to trust because we're so dependent. We also have other qualities. We have the ability to be emotionally available to other people, emotionally connected to other people. We also have the ability to be confident within ourselves. If we're connected to our authentic true selves, we are confident. That doesn't mean arrogant, but it means confident. Yes. And we also have the ability, one of the greatest abilities that we have is to be compassionate. So that's where we are. And today we're going to be talking about addictions, codependency, and trauma. And we're going to focus on some of the things that we need to do in order to heal from codependency. We've talked a lot in the past about why codependency is and where it comes from and how it came to be. And today we're going to talk about some of the healing qualities of codependency.
Exactly. And when you say, we are innocent, we always say, look at this innocent child, right? Mm-hmm. So there is a very much truth about that children, for as long as we are a child, we act so innocently until we learn how to defend ourselves due to a variety of factors.
Right.
So I'd like to invite you all to please call us at 951-922-3532. That's 951-922-3532. You can also visit us online and then at YouTube, heart-2-heart.online/YouTube. And pretty soon we're going to be on Facebook Live. So that will be a better opportunity for you to visit with us and stay with us live during our program. And we understand that many of you prefer to be online versus calling us, right? Mm-hmm. So we are working on that. Just for you to know that we are aware and we are working towards that step, and soon it's going to be done. So we appreciate your patience and we appreciate your giving us your Friday morning at 9 o'clock joining us. So Dr. Jaffe,
yes, ma'am.
Codependency,
yes,
the big umbrella in life that pretty much many people, live underneath of that, and they're not even aware of it, mm-hmm. right? And then I just was talking to a friend psychiatrist about a couple that I'm treating, mm-hmm. and as you walked in, and then so what's happening is that this lovely couple, they're amazing how talented they are, and then how much they love each other, but the relationship is becoming so frustrating for both of them, just exactly because of the codependency.
Yeah.
And they're not aware of that. They have everything they want. They have a luxury life. They both are highly educated. They want to have a child, but they just don't know where the conflict is from, how it is initiating, right? Like the lady, she wants to be independent, and she has her own business, and she's really working towards her independence and all of that, and the husband is for it, and he says, oh my God, she's so independent, she needs to be independent. However, in reality and in action, what happens, the lady gives in to her husband, and the husband takes over and controls everything,
Right.
you know?
Yeah.
So, and they don't know how this is happening. They both, consciously, they don't want this to happen, but ultimately this happens.
Which goes to the title of the upcoming book that we're writing, which is The Subconscious Runs the Show.
Yes. Yes. And then when I told the psychiatrist that this is a pattern that I have seen, and how it, their subconscious basically runs the show, he was very much appreciative of hearing that. And he said not too many people actually have this approach. And
that's too bad.
Yeah, that's too bad.
Yeah.
So focusing on the subconscious as a way to understand how codependency has developed in a person, and how that codependency, plays a role in within marriage and within all types of relationship, and in particular sexual relationship, is really essential.
Absolutely. So it all boils down really to emotional pain. When we talk about addictions and we talk about codependency, what we're really talking about is emotional pain. And where does emotional pain stem from? Often it stems from, I hate to say the word, it's not a dirty word, and I know that therapists are accused of this, but we're accused of it for a very good reason. It stems from childhood, right? And in the beginning, there was childhood. And when there was childhood, we did not have the left part of our brain developed. Left part of our brain is logic. And that part of our brain develops throughout our lives. However, we are born with our right brain pretty much developed. We are able to feel the same feelings actually when at birth that we're able to feel throughout our lives, including sexual. Even, what we've learned recently in the sexuality seminar that we're taking is that baby boys actually can have erections in the womb, and they've realized that baby girls can begin lubricating as early as 3 days, and maybe even earlier.
Right.
And
then there was also this article that I read a long time ago, that a baby girl can actually have an orgasm, at the same age.
Oh, really? Wow.
Yes, and then that's why it's recommended that when they wipe babies, to be
Change.
do it to change the babies, to do it in such a way that to be sensitive, and not to do it in a way that can cause
that can cause sexual excitement.
Sexual excitement.
Right.
Yes.
Right. And the reason for that, of course, is that emotionally, even though physically the baby can still experience that, emotionally.
Yeah, eventually they will. Yeah.
Well, yeah, but emotionally the baby isn't ready for that that powerful feeling, and it can become detrimental, of course.
Right.
So going back to emotional pain, that's the origin of most psychiatric disorders. And it's certainly the origin of codependency. And I would say the origin of most, and I'm not sure if it's all addictions, but certainly most addictions have at their core emotional pain. And unfortunately, as you just stated, most people, and unfortunately it's true in the therapeutic community as well, don't look really at the emotional pain. They look more at the behavior, and they just try to change the behavior. And of course, there's nothing wrong with changing the behavior. That's important. Certainly, if you have addictions and you're a slave to the addiction, changing the behavior can make a big difference in your life. And I'm not putting that down at all. However, it doesn't really address the core issues, which are, and often as a result of not addressing the core issues, which is emotional pain, what happens is people, they may recover from one addiction only to discover that they have another addiction. For example, they go from using drugs and alcohol to overeating, or they go from using drugs and alcohol to smoking cigarettes. Or if they did smoke cigarettes anyway, they increase the amount of cigarettes that they smoke. And what they're really doing is they're trying to ameliorate the emotional pain through the addiction. Addictions give us emotional relief from the emotional pain. But if we're used to having the emotional pain, we don't realize that that's what it is. And what we usually do is we call it stress. We say, so I smoked a cigarette because it relieves my stress. And we put the word stress in as a substitute for emotional pain. And the emotional pain is there. Perhaps it's been there their whole lives or since early childhood, and they're used to it, so they don't think they think that everybody's got it, and they don't recognize that there's actually something that's causing it, not just stress, but there's internal conflict and pain that they've carried on within them since they've been children.
Exactly, yes. So again, no matter how we look at this, we go back to childhood.
Yes.
We go back, it's like we go back to the drawing board. We go back to fundamental aspect of development.
Correct.
Right? We go back to our early part of life and how we started, how the seed that was planted called a child, and it starts to stem outside the ground, and it shows the leaves and the branches and all of that, how parents learn to give the child a safety kind of a fence so that the child can grow on the fence and then stay up and healthy and get the sunlight to grow versus just growing on the ground and hope for the best to find something to wrap around and then go up.
Exactly.
It's just so critical, to understand really a child growing up in a healthy way is a change of generation. Every child, when they become an adult, they can change the society, but how they are and who they become, right? That's how crucial childhood is. That's how crucial, the responsibility of parents, are.
Right.
Right.
And it's very interesting that we don't really have any training to be parents,
right,
other than the obvious training of how we were parented.
I tell you what, we don't have any training on how to have sex. If it wasn't for nature, most people wouldn't know how to have sex.
Well, yeah. When you say how, the how is a biological imperative.
Yeah, right.
We know most
biologically
people,
nature did its job.
We know how to touch and stimulate and excite each other.
Right.
That usually is not the problem when people come in with sexual issues. It's not that they don't know how. It's that they don't know what keeps them connected.
Exactly.
And it isn't just on the physical level. Of course, the physical is important, but they don't know how to stay connected. And the reason they don't know how to stay connected is because they're carrying inside of them emotional pain that has never been addressed.
Yes. And I think we just got the signal for commercial break, if I'm not mistaken. So let's come back, to this amazing topic after commercial break. If that's the case, I hope I'm not mistaken. I'm not hearing the music today, so I'm just going by the time, and I'm just guessing that that's the commercial break. And we'll see you in a short few minutes.
Okay. See you soon.
Is your
6,
7, 8, 9, 10, and welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Dr. Mitra and Dr. Robert here. And for those of you who just tune in, we are talking about codependency and its origination and its development and how it impacts human lives in variety of dimension of life and in different stages of life. We would like for you to call us, please, and share your questions. 951-922-3532. If you have any insight about this, if you have any experience about this, we're happy to hear about that. And this is not going to be a therapy session. When you call us, we're just going to share information and have a short discussion, and hopefully we can help you understand some of what's going on. And also we would like for you to share our program with those that you believe they can benefit from this, from our conversation. And we are on YouTube, Heart-2-Heart.online/YouTube. You can also visit us there for the same programs. And soon we're going to be on Facebook Live. So with that, welcome back, Dr. Jaffe.
Thank you. We're talking about codependency as the most common addiction. That is probably the most addiction, the greatest addiction that goes undiagnosed. People don't recognize it, and it's a way of being with your partner, and it's a way of being in the world as well.
Yeah, it's a disease of lost selfhood.
Exactly. And so we don't have our loving, authentic, true selves online. What we have is what we call our adapted self. Or what some people call the false self. And the adapted self, or the false self, is that part of us which we use to adapt to the family that we grew up in if the family was not conducive to us showing our authentic true selves. So if, let's say, for example, I'm going to give you a very simple example. If you're crying, in your family, what did your parents do? Did your parents say, "Oh, what's the matter, honey? Come here. Let me hold you"? I'm talking about crying not for a physical pain, but crying because something is upsetting you.
Right.
Come here, honey. Let me hold you. Or, oh, did your sister take that away from you and you're disappointed? Oh, I'm sorry. Your sister wants her turn too. Did they talk to you that way, or did they talk to you and say, "Hey, what are you crying about? It's no big deal. Get over it." Or stop that crying, or even worse, you cry and I'll give you something to cry about, which is to me the most devastating message. That's just one basic example.
Or boys don't cry.
Or boys don't cry. Yeah. Or if you think that's bad, wait till you grow up and you really, understand what to cry about.
Right.
And so basically denigrating the child's feelings. And so what happens is we learn as children to fit in, because we need to fit in as children. We're totally dependent on our parents, and we can't do for ourselves. We can't feed ourselves. We can't go out and get a job. We can't tell our parents, "I don't like the way you're talking to me." And I'm talking when you're very young. You can't do that, because first of all, you don't even recognize that they're doing anything wrong, and we're really not even allowed to recognize that we're doing anything wrong because we are so dependent. We need to believe that our parents are there and taking good care of us. And of course, we can begin to understand that they're not as we get older, but by that time, often the damage is done. So what we were talking about earlier is emotional pain. And what happens is if we're given messages like, you cry and I'll give you something to cry about, so we then hold back our tears, then we may form a message inside of us that people don't want to see us cry.
Well, not only that, I'd like to add to it that, we're not just holding back our tears, we're holding back our voice.
Yes.
As though we don't have a voice, or we can't have a voice, or what we have to say is not of any value, and I shouldn't talk about what I want to say or what I want to feel.
Right. So what is the result of that if we end up holding back our voice, or even not our whole voice, just the voice of sadness? Let's say we're using that as an example where, I'm sad, but I'm not going to cry. I won't show the other person my tears. I won't show them my tears because I learned early on that they weren't welcomed. or that I was shamed for feeling sad or shamed for crying, or that other people are going to think that I'm a big baby, and that big babies, those two words are used so much in our society. I'm a big baby because I cry so easily and I can't stop myself and I feel ashamed for crying. What happens then is the feelings go underground. And underground simply means getting lodged in our subconscious minds. So we then caught with the need to cry, or the need to talk about our sadness, or the need to be comforted without the ability to ask for it or to show it to other people. And when we can't ask for it or show it to other people, that becomes emotional pain that is what we call repressed or held in, and then it becomes a problem in our later relationships. So let's say you're now an adult and you want to form a relationship with somebody, an intimate relationship, and that person then has a loss. They come home and they say, somebody at my work, I had their dog put down and I feel horrible. And you look at them and you go, well, yeah, but it's just a dog. I mean, why would you feel horrible? See, and then that person feels like, oh, you're not empathizing with me. I do feel things, and you apparently don't. And why don't you? And you don't think it's any big deal. It's just a dog, and it's not even your dog. So that's the beginning where you're missing in terms of connecting with that person on an emotional basis, and you don't know that it might be a normal thing to feel sadness for someone else who lost their pet. Even if you don't have a pet, you might be able to empathize, but you've learned to cut that off within yourself because it wasn't welcomed, or it was unwelcomed in your family of origin, and you don't even remember consciously that happened.
Exactly. Yes. I mean, many things that we do, while they are stored in our subconscious, and of course, when they are in subconscious, we are not aware of it, but we do it, and we just sometimes, we surprise ourselves about some of our choices, some of our decisions.
Exactly.
Right? And say, I'm not sure why I did that, but it just happened.
Right.
Well, nothing just happens.
Yes.
Right.
Yes.
We already have and stored a memory in our subconscious that leads us into, doing things, making decisions. Some of those decisions are abrupt. Some of them, they just preoccupy us, and we're just waiting for that significant right moment to make a move. Right.
Right.
But we just don't understand ourselves. We don't. And I mean, it's so automatic. It's so engraved that our mind can't just think otherwise.
Right.
Right.
Right. Yeah. And Sigmund Freud, who many of you know the name, many of you who are not therapists don't understand a lot of what Freud talked about. Some of what he talked about was very valuable. And one of and a couple of things that he said that are very important. He said that the purpose of all effective psychotherapy is the transmutation from fear into love. And he also said that another purpose of effective psychotherapy is to make the unconscious conscious. And why do we want to do that? It's because of what you just said. It's because we have reactions to things and we say, oh, it just happened. But actually, it's a subconscious response. And since we don't know why it's happening, we just keep responding in the same way. We don't have a choice as to how we react to things.
Exactly. I mean, I have heard this so many times from my clients. And on my personal level, I have experienced this as well, where people, when they get angry, where they get upset, where they get sad, they say something and then suddenly they say, oh my God, I didn't mean to say it that way. Mm-hmm. Right? Mm-hmm. But exactly, no, that's the
way
opposite.
That's where the subconscious came out and said it the way that they really wanted to say it.
Right.
But consciously, it wasn't exactly how they wanted to say it.
Exactly. So we see that. I have heard it myself. I have seen it with my clients. They said that, well, you made me angry, and therefore, if I wasn't angry because of what you said or what you did, I would not have reacted the way I did. it, or I would not have said what I said, and I didn't really mean it. And, I'm sorry I hit you. I'm sorry I pushed you.
Right.
But, that's only the conscious level. The reality is that the subconscious runs the show, and the subconscious is dictating how we need to approach a situation and how to take care of ourselves, essentially. So those are our defenses that they come into the play, right? And then our defenses are part of our subconscious.
Right. So what we do in psychotherapy is we teach people how to stop reacting and start responding. And you can only respond if you're aware of what's going on inside of you. If you're not aware, then we just react.
Right.
And the reaction is usually based, as you said, on old programming. So going back to codependency, which you said quite accurately, is a disease of lost selfhood, means that we are reacting to things rather than responding to things. Right. And the more we do that, people can call it buttons, you pushed my button, right? But when say you pushed my button, although technically that's correct, because the button that they pushed was an unhealed place within you, it doesn't mean that you have to react the same way over and over again if you're aware of what that button is and why it's happening.
Exactly.
So, for example, if I say to a partner, that lady on TV, she reminds me so much of your mother. And when I use the word mother can be a trigger word. It is a trigger word for a lot of people. And so when I say mother, depending upon how I'm saying to my partner, depending upon how my partner has that relationship with his or her mother, may be a compliment. She reminds me of your mother. Oh, well, that's nice. I really like my mother. Or maybe a criticism. Oh, my mother. Oh, I don't like her. Yeah. So I pushed her mother button, right? But if she's not aware of the fact that she has, not that she likes or dislikes her mother, but that she's having a reaction to being compared. And that she's going to maybe say to me, "Why did you say that? Why did you say that?" See, and immediately she's defensive, and now I'm getting defensive because she's saying I did something wrong. Maybe I have a different feeling about her mother than she does or he does, and so I'm thinking it's a compliment. She's thinking it's not a compliment, and we're immediately misconnecting.
Yes, right.
So, what I want to say about this is that if you think that you are reacting a lot in your life to your partners or to other people, if you have a lot of reactions and you feel as though those reactions are not serving you, then it's important that you understand what's going on subconsciously.
Exactly.
And
yes.
The best way to do that is to find a therapist who is knowledgeable about working with the subconscious and can help you to understand what's going on inside of you so that you're not reacting, so that you begin to respond. Because once you respond differently, everything changes.
Exactly. I mean, the example you said, so it can go both positive or negative. The negative, and I have heard, people say to each other, "You're just like your mother," so yeah. That's the tone of voice actually suggests, that how the relationship has been with the other person and their mother.
Right.
Or sometimes you're worse than your mother, So we hear these things a lot.
Yes.
Right.
Yes.
And then, or, you're just like your father, and then, when situation like that happen, depending on where the relationship, like you said, has been with those parents, definitely, creates conflicts or creates complement, but mostly what we see is creating conflicts.
Right.
Yeah.
So when people enter therapy, they usually enter with what we call a presenting complaint. I'm having marital difficulties. Okay, so marital difficulties becomes the name of the book, right? But then what do you do if you're bringing a book in and the book is named marital difficulties, or the book is named sexual problems, or the book is named anxiety, or the book is named depression? Well, that's the whole book. Now we can either try to skip to the exact part of the book which gives you the solution, but if we do that, you don't know how it fits in with the rest of the book, right? So you have to start reading the book and understanding what the book is telling you in order so that you can then figure out what the solution is. People often think when they enter therapy that the therapist is there to tell them what to do. And that is true, that the therapist does tell you what to do if you are in a very dangerous situation. If you're in, let's say, if you're in a physically abusive relationship, the therapist may say, this is very dangerous for you, and I really recommend that you distance yourself because your partner is dangerous and your partner can really hurt you or kill you. That's the type of thing where the therapist is going to give suggestions.
So let's talk more about this, because I think I heard the signal for commercial break.
Okay.
Okay, and then if that's the case, and I hope that's the case, and I'm not closing before the time, but let's hope that this is the commercial time, and then we will see you back in a short few minutes. Thank you.
Okay, we'll see you soon.
Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM ABC News Radio. Dr. Mitra and Dr. Robert here. Our phone number live is 951-922-3532. We would like to invite you to join us, share your perspective about our program, what you hear, what would like for us to share with you, and also, if you can please, share this program with those that you believe they can benefit from this program. And we're talking about codependency, the big drama and the biggest addiction that human being has been involved with, especially recently. I mean, it's amazing that how the more we are making progress and we become advanced in society, the sense of codependency increases.
Mm-hmm. Okay.
Right?
I don't know. You're saying that I don't know, but and it certainly is pretty widespread.
It is widespread, and then I see myself codependency more often happening in my practice than they used to, right? And I hear more about the symptoms of codependency among other people. Mm-hmm. I think the more we are involved in technology, and the more we are involved in self-advancement, and the more we are involved in, making goal, to kind of get to our goals and achieve this and that, and all of that sense of emotional connection kind of evaporates. Mm. And then what we see that parents who are involved in their profession, they have less time for their children, right? So therefore, there is less connection, less emotional connection. There is less time to have that emotional connection that parent and a child needs to have. And these children, when they grow up, that sense of codependency shows in them. We see that.
Mm-hmm. Okay. Well, that certainly is I mean, there's truth in it.
Right.
Yeah,
right.
Definitely.
Yeah.
I wanted to talk a little bit about the major thing that prevents people from entering psychotherapy and dealing with their codependency issues, and that is the protection of the parent. What that means is people say, my parents did the best they could, and they gave me a lot, and I don't want to feel anything negative toward them. Mm-hmm. And if I've heard that one time, I've heard it 1,000 times. And I think that's probably there's a lot of blockers that keep people from going into therapy, but I think that's the major blocker. And the more protective we are of our parents, protective meaning that we're not supposed to speak ill of our parents, you're supposed to honor thy mother and thy father. which to a lot of people means you're not supposed to have your legitimate feelings toward them as people. The more that the person believes that, the less inclined they're going to be to find out what's really going on inside of them that may have to do with the way that they were parented. We are not here as therapists to bash parents. Actually, what we're here to do is to help people understand the reality of what they did get and what they didn't get. And so when people talk about what they did get, we want them to feel really good about what they did get, and we want them to celebrate what they did get. And when they didn't get something, or when they got things that they didn't want or need or were hurtful to them, we want them to also be able to feel the hurt and the pain, and to what we call work through or release those feelings, so that those feelings don't continue to plague them subconsciously. And to me, if a parent really loves you, the parent wants you to feel happy as much of the time as you possibly can. And if the parent is wounded themselves, and then you start to recognize that the parent has done things which are not in your best interest, and you say that to the parent, and the parent becomes defensive and tries to turn it around and put it on you, then the parent is not operating from their loving place. The parent is operating from their own wounded place.
Exactly.
Yeah.
Yes. Right.
And it's important. And so one of the big elements of psychotherapy, I think, that enables some people to do it and other people to not do it, is the idea of the love of truth. Because people who enter psychotherapy need to be committed to finding the truth of the emotions and the circumstances and what actually happened.
I love the term love of truth.
Yes.
That's beautiful.
Yes, it's not something that I came up with, actually. Yeah. I learned that from another therapist that I work with once. But love of truth has to be an essential ingredient. And of course, we're living in an age right now where truth has become something like, your truth is different than my truth, right? But yes. No. My perspective on things may be different, but truth is truth. You know,
yes.
If you slap me across the face, that's truth. You know, why you did it, may vary. That's different. But the fact that you did it is a piece of truth. And how we feel when we're abused, or how we feel when we're neglected, is also truth. And dealing with the truth of our feelings is what can liberate us. And when we don't deal with the truth, and we deal with the idea that I'm not supposed to, or I'm afraid to feel negative feelings toward my parents, then we are inhibiting our own growth, and are inhibiting our own ability to be loving to ourselves and to others.
Exactly. I mean, I like to ask a question. Sometimes, I try to explain this to my clients, and I see that there is a level of difficulty to understand this. And that's the difference between truth and fact. Mm-hmm. Right?
Right.
So to me, truth is something that's happened, right? Slapping somebody's face,
right?
Pushing the wife to the wall, or name calling a wife, or hitting a child, or not responding to a child's need. That's the truth mm-hmm. of what's happening, right? Mm-hmm. Mm-hmm. But the fact of it, why it's happening, so that's the other side of it.
Well, I mean, you're
so the fact is, like, what causes something that's happening.
Well, now you're talking about motive.
Motive, yeah.
The motive, yeah,
right.
Yeah. So I would say truth and fact are synonyms. I think truth are facts, and so if she slapped you across the face, that's a fact, and that's also truth, right?
Right.
If she did it because she was out of control, then that's a motive.
That's a motive,
yeah.
Yes.
If she thought that it was good for you, then that's a motive. but still the fact is the same thing. The truth is what actually happened.
Right.
And so our feelings truths, or our feelings motives, or our feelings facts? Our feelings are actually truths. When we feel something, that's a truth. It doesn't mean that our feelings encompass the totality of the situation. So, for example, if my father used to make a face before he got angry with me, and now I'm in a relationship and my partner makes the same face, and I have a reaction to it because I think my partner is going to be angry with me. That's a trigger for me. It doesn't mean that my partner is angry with me. So that's not a fact that my partner is angry with me, but it is a fact that my father used to make that face, and I now have that as a trigger inside of me.
Yes.
Yes.
Right.
Yeah.
Right. So I mean, these are all the delicate points.
Mm-hmm.
These are those microscopic points that in therapy we open up.
Right.
And we help clients to see, to experience, to understand, and to make sense out of. Right.
Right.
So this is how they can make connection to their own truth and to their own fact and to their own motives.
Right. Right.
Many times the truth, truth is something that happens. Many times the motives that we have are sort of motives that we borrow from what we witnessed.
Right.
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 And we say, okay, well, that's the way to do things, right?
Mm-hmm.
My mom did it this way, so my dad did it this way. It worked for me, so why not working for my child?
Correct.
Right?
Correct.
But the reality is, sometimes we need to look at how those motives are applicable today.
Mm-hmm. Mm-hmm.
What happened, 25 years ago or 30 years ago in my life, or 60 years ago in my life, is applicable today for my child.
Right.
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 Maybe some of the what's the word for it?
Old ways.
Old ways still can be used, like value system. Some of the value system we definitely don't want to miss. We don't definitely want to continue with that.
Right.
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 But how things have been done, they can be sort of like a computer software obsolete today.
Yes. Yeah. Yeah. And what's interesting also is how people want to justify what their parents did in the service of saying it didn't do me any harm. Yes, I got spanked.
Yeah.
But it didn't do me any harm. I'm still a good person today. And I say, well, do you spank your kids? Most of the time today, what I'm getting is no. There are people who still do it, but most of the time when in therapy, when I ask that, the person says no. And I say, well, why not? And they say, well, because I don't feel like it's right to hit. And I said, but you got hit. And they go, yeah. So they've drawn, again, they're protecting their parents from the fact that their parents could have taught them a lesson without ever having to strike them.
Exactly.
Yes.
And then some people that I hear, and they say, well, we have a spanking and a spanking. If we spank our child on their butt, that's okay. Right?
Yes.
So I don't know actually about that. I don't know how spanking a child on their butt is different than spanking them on the back of their hands, or spanking them, somewhere else in their body. I myself haven't been able to make sense out of that.
Right.
Right.
Well, they're saying the butt because the butt has the most
cushion.
Fat covering. It's not going to hurt them that badly
physically.
But what you're talking about is giving the child the impression that it's okay to hit under certain circumstances.
Right. I'm a huge believer of educating and talking to children, helping them understand. Of course, that means we need to understand their emotions and their motives and what's going on with that before we can, start to teaching them other ways. So it's communication. I mean, no matter how we look at it, communication applies everywhere. I don't believe spanking is anywhere in the child's body is a system of doing
well,
that.
It's people use the word spank rather than the word hit because it's more accepted.
Socially acceptable.
It's acceptable.
Yes.
But really, spanking is simply a form of hitting, as though as children we need that kind of sledgehammer in order to learn. And people need to understand that we are very, very, very sensitive creatures. We are born so sensitive that we pick up on such nuances. We pick up on such minute body language, and such minute facial expression, such minute voice tone, and we pick up on it very, very powerfully. And as I was saying earlier, our right brain, which is sensitive to our emotions, is developed. So we get that at birth.
At birth, exactly. I mean, for a child who's used to getting spanked for a variety of reasons, doesn't matter which area of body, that becomes a measure of, as long as I'm not spanked, my behavior is fine. So once I get to the spanking, that's when I need to think about it.
Yeah.
So we need to be mindful of that. And, I think we're getting towards the end of our program.
Already?
I think we have 2 more minutes, as a matter of fact. So I'm glad to say that we have these 2 minutes. Codependency happens in different forms. It, depending on parental approach to how they raise their child, how they communicate with them, how they touch them or spank them. And it's touching, it doesn't matter how, it just has an aggression to it versus a loving, touch to it. Children, this is how they form their own base.
Yes.
Right?
Yes.
Base of, I'm not getting hit, so that means I'm okay, I can get away with it. So we want to know how we're teaching our children to set a limit, to create boundaries that doesn't involve any type of aggression of that type. That shouldn't be the base of measurement for children's behavior.
Yeah. And I can say, from my own personal experience, my 2 children, my son and my daughter, I never hit them. I probably yelled maybe a handful of times between the both of them, and neither one of them are having problems in their relationships or in society.
But I didn't even do that. I was just always education, and I'm so proudly to say that.
Well, that's great.
Yes,
that's great.
But I'm not saying that you did wrong. I don't want to say that.
I know I'm not. I mean,
I love your children. They're just amazing. Seriously, they are. We're lucky.
Thanks.
We have 3 wonderful children.
Yeah. So. We will talk more about codependency, more about how to recover from codependency. We're so thrilled that you've joined us in this hour, and we look forward to talking with you next Thursday, where Dr. Rashidian will talk a lot, and I will join her about sexuality and relationships, and next Friday again about addictions, codependency, trauma. We wish you the greatest weekend, and stay safe out there.
And all you need is love.
All you need is love. Bye-bye.
Bye-bye.